Question 1. In the context of radiation protection, Mr. Adams is working with radioactive materials in a laboratory. He is aware of the basic principles of radiation protection but is unsure about how to apply them effectively in his daily work. Given that he frequently handles highly radioactive substances in confined spaces, which of the following principles should Mr. Adams prioritize to minimize his exposure? A. Using shielding materials of sufficient thickness to reduce radiation exposure. B. Minimizing the amount of radioactive material used to limit potential radiation exposure. C. Increasing the distance between himself and the radioactive source to reduce exposure. D. Reducing the amount of time spent in the laboratory to minimize exposure. Answer. Correct answer, D. Reducing the amount of time spent in the laboratory to minimize exposure. Explanation. The principles of radiation protection are based on the 3R time, distance, and shielding. The most effective way to reduce radiation exposure is to reduce the time spent near radioactive materials. Option D. This minimizes the dose received. The distance principle, option C, is also crucial but is not always feasible in confined spaces. Shielding, option A, is important, but reducing time is generally the most effective way to limit exposure. Minimizing the amount of radioactive material, option B, is important for controlling exposure but is secondary to managing time in this scenario. Question 2. When analyzing the performance of a gamma camera in a nuclear medicine department, Lee notices that the images obtained are blurry and lack sufficient detail. What is the most likely explanation for this problem? A. Incorrect collimator selection for the type of scan. B. Insufficient dose of radiopharmaceutical administered to the patient. C. Faulty scintillation crystals in the gamma camera. D. Low quality of the radiopharmaceutical injected. Correct answer, A. Incorrect collimator selection for the type of scan. Answer. Explanation. In nuclear medicine imaging, the collimator is crucial for controlling the direction of incoming gamma rays to ensure that only those traveling in a specific direction are detected. If the wrong collimator is used, the image quality can be compromised, leading to blurring or lack of detail, option A, while issues like a faulty scintillation crystal, option C, can affect image quality. They usually manifest as more severe artifacts, total loss of image rather than blurriness. The radiopharmaceutical dose, option B, or quality, option D, primarily affects the overall image brightness or localization, not sharpness or detail. Question 3. During a nuclear medicine scan of a patient with a suspected thyroid condition, the technologist notices an abnormal biodistribution pattern of the radiopharmaceutical. Which of the following is the most likely cause of this abnormality? A. The radiopharmaceutical is incorrectly stored prior to administration. B. The patient has a history of thyroid disease that affects uptake. C. The patient was not instructed to fast before the scan. D. The imaging equipment was not properly calibrated. Answer. Correct answer, B. The patient has a history of thyroid disease that affects uptake. Explanation. Biodistribution patterns in nuclear medicine are strongly influenced by the physiological condition of the organ being imaged. In this case, a history of thyroid disease can alter how the thyroid cells absorb the radiopharmaceutical, leading to abnormal biodistribution. Option B, while improper storage of the radiopharmaceutical. Option A, affect its potency or sterility. It typically results in reduced uptake, not abnormal patterns. Fasting instructions, option C, primarily impact gastrointestinal studies, and calibration issues, option D, usually result in overall image quality problems, not specific biodistribution abnormalities. Question 4. Under the assumption that a radiopharmaceutical is being administered intravenously to a patient, which of the following is a critical factor in ensuring its safe and effective use? A. The radiopharmaceutical should be injected at a slow, controlled rate to avoid adverse reactions. B. The patient must be kept in the supine position during the entire imaging process. C. The radiopharmaceutical must be preheated to body temperature before administration. D. The technologist should monitor the patient for 15 minutes after injection to ensure no immediate reactions. Answer. Correct answer, A. The radiopharmaceutical should be injected at a slow, controlled rate to avoid adverse reactions. Explanation. For intravenous radiopharmaceutical administration, it is crucial to inject the substance slowly to reduce the likelihood of adverse reactions such as extravasation or anaphylaxis. Option A. The patient's position, option B, is not generally a critical factor unless specified by the specific imaging protocol. Preheating the radiopharmaceutical, option C, is not standard practice and could compromise the integrity of the compound. Monitoring the patient, option D, is important but typically occurs for longer period, especially if there is concern for delayed reactions rather than 15 minutes immediately following injection. Question 5. Which of the following types of detectors is most commonly used in a nuclear medicine department to detect gamma radiation emitted from radiopharmaceuticals during imaging procedures? A. Geiger-Müller counter. B. Ionization chamber. C. Scintillation detector. D. Thermoluminescent dosimeter. Answer. Correct answer. C. Scintillation detector. Explanation. Scintillation detectors are the most common detectors used in nuclear medicine because they efficiently detect gamma radiation emitted from radiopharmaceuticals. These detectors convert gamma radiation into visible light, which is then converted into an electrical signal. Option C. Geiger-Müller counters, option A, are more commonly used for general radiation monitoring but are not suitable. Detailed imaging. Ionization chambers, option B, are used for measuring radiation dose but are not typically used in imaging. Thermoluminescent dosimeters, option D, are used for personal dosimetry and are not used for imaging purposes. Question 6. Mr. Williams is working in a nuclear medicine department where a large volume of radioactive material is frequently handled. To minimize radiation exposure to himself, which of the following actions is most appropriate in his workplace? A. Increase the amount of shielding between him and the radioactive source. B. Spend as little time as possible in proximity to the radioactive materials. C. Ensure all radioactive materials are handled in open-air environments. D. Wear protective clothing, but no personal radiation monitoring equipment. Answer. Correct answer. B. Spend as little time as possible in proximity to the radioactive materials. Explanation. The best way to minimize radiation exposure is to limit the amount of time spent near radioactive materials, following the time principle of radiation protection. Option B. While increasing shielding, option A, is important, reducing time is often the most effective method in a workplace where high levels of radiation are present. Open-air environments, option C, are not recommended for handling radioactive materials as they do not effectively contain radiation. Personal radiation monitoring, option D, is critical in tracking exposure, so Mr. Williams should wear proper dosimetry. Question 7. When considering the clinical use of positron emission tomography PET, which of the following factors most significantly impacts image quality? A. The type of collimator used during the scan. B. The half-life of the radiopharmaceutical used. C. The number of rings in the PET scanner. D. The position of the patient during the scan. Answer. Correct answer. B. The half-life of the radiopharmaceutical used. Explanation. The half-life of the radiopharmaceutical directly impacts image quality in PET scans because it determines the duration of the imaging session and the amount of time the radiopharmaceutical remains active within the body. A shorter half-life means the substance decays faster, potentially reducing image quality. Option B. Collimators are not typically used in PET as they are in cameras. Option A. The number of rings in a PET scanner, option C, impacts spatial resolution but is less influential than the half-life. The patient's position, option D, is important but not the most significant factor in image quality for PET. Question 8. During a routine quality control check on a nuclear medicine gamma camera, the technician notices significant image degradation. What is the first step the technician should take to address this issue? A. Recalibrate the gamma camera to correct image distortion. B. Perform a thorough check of the scintillation crystals for any signs of damage. C. Increase the exposure time to improve image quality. D. Inspect the collimator for misalignment or damage. Answer. Correct answer. D. Inspect the collimator for misalignment or damage. Explanation. The collimator plays a vital role in directing gamma raised toward the detector, and any misalignment or damage could lead to image degradation. Therefore, the first step should be to inspect the collimator. Option D. Recalibration, option A, might be necessary but is not the first action. Checking the scintillation crystals, option B, is also important but results in complete loss of image quality rather than degradation. Increasing exposure time, option C, can lead to higher radiation exposure but would not necessarily improve image quality. Question 9. Mr. Zhang is handling radioactive iodine in a clinical setting for a thyroid treatment. He notices an increase in the ambient radiation levels in the room. What immediate action should Mr. Zhang take according to radiation safety guidelines? A. Leave the room immediately and inform the radiation safety officer. B. Increase the shielding between himself and the radioactive material. C. Immediately begin monitoring his personal radiation dose with a dosimeter. D. Attempt to reduce the exposure time by speeding up the procedure. Answer. Correct answer. A. Leave the room immediately and inform the radiation safety officer. Explanation. In the event of increased radiation exposure, the best immediate response is to leave the area to minimize exposure and to inform the radiation safety officer to investigate. Option A. While increasing shielding, option B, and monitoring radiation dose, option C, are important steps. The first priority in the case of high radiation exposure is remove oneself from the source. Speeding up the procedure, option D, is not a recommended action and could lead to increased exposure. Question 10. From the perspective of radiopharmaceutical chemistry, which of the following factors is most important when selecting a radiopharmaceutical for a specific imaging procedure? A. The radiopharmaceutical's ability to emit gamma radiation for detection by imaging equipment. B. The radiopharmaceutical's half-life to ensure adequate time for image acquisition. C. The radiopharmaceutical's ability to target specific organ or tissue for imaging. D. The radiopharmaceutical's cost-effectiveness and availability in the clinical setting. Answer. Correct answer. C. The radiopharmaceutical's ability to target a specific organ or tissue for imaging. Explanation. The most important factor when selecting a radiopharmaceutical is its ability to target the organ or tissue of interest. Option C. This ensures that the radiopharmaceutical is localized appropriately, allowing for clear and accurate imaging of the target area, while the ability to emit gamma radiation, option A, and the half-life, option B, are important. They are secondary to the targeting ability. Cost effectiveness, option D, is a consideration but should not outweigh clinical efficacy. Question 11. With respect to radiation protection, MS Keating, a nuclear medicine technologist, is preparing a high-activity dose of I-131 for therapeutic use. She needs to work swiftly and safely within the hot lab environment. She minimizes her exposure time, uses lead glass shielding, and stands as far away as possible when manipulating the dose using tongs. Which principle of radiation protection is she predominantly applying? A. Adherence to good radiopharmacy practice (GRP). B. Optimization under the ALARA principle. C. Implementation of time, distance, shielding principles. D. Compliance with radiation incident response protocols. Answer. Correct answer. C. Implementation of time, distance, shielding principles. Explanation. MS Keating's actions reflect the core radiation protection principles. Time, working quickly, distance, using tongs, and shielding, lead gas, as outlined in the NZ Code of Safe Practice for the use of ionizing radiation in medical imaging or the Ministry of Health. These are fundamental to minimizing exposure, especially with high-energy isotopes like I-131. While ALARA supports minimization, it is an overarching philosophy. The correct specific practice is time, distance, and shielding. Question 12. Based on the information, a technologist performs a thyroid uptake study and observes unusually low iodine uptake despite proper patient preparation. What is the most likely technical factor that should be investigated first? A. The energy window setting of the gamma camera. B. The patient's dietary iodine intake. C. The calibration of the dose calibrator. D. The camera head collimator alignment. Answer. Correct answer. C. The calibration of the dose calibrator. Explanation. Inconsistent calibration of the dose calibrator may lead to administration of incorrect activity, directly impacting uptake results. According to NZ Aviation Protection Regulations and IA safety standards, daily quality control of dose calibrators is required. While dietary iodine intake and energy window setting are relevant, this scenario focuses on a factor within the technologist's immediate control and protocol. Question 13. To illustrate this point, Mr. Lawrence, a patient undergoing a SPECT myocardial perfusion scan, moves his arms during the acquisition phase. The resulting images display unexpected artifacts. What is the most probable artifact seen in this case? A. Truncation artifact. B. Motion artifact. C. Attenuation artifact. D. Star artifact. Answer. Correct answer. B. Motion artifact. Explanation. Motion artifacts are common when patients move during SPECT acquisitions, especially during cardiac imaging. These distort perfusion patterns and can mimic ischemia. According to NZMRTB and IA technical reports, motion must be minimized and corrected post-acquisition if detected. Attenuation artifacts are common in obese patients. Truncation occurs if anatomy lies outside the field of view. Star artifacts arise from high-energy photon collimation mismatches. Question 14. The prevailing attitude toward radiopharmaceutical preparation stresses the importance of sterility and quality. What is the primary regulatory reason for pyrogen testing in radiopharmaceuticals? A. To assess biodistribution accuracy. B. To identify radiolytic decomposition. C. To prevent febrile reactions in patients. D. To determine radionuclide purity. Answer. Correct answer. C. To prevent febrile reactions in patients. Explanation. Pyrogen testing is vital to prevent harmful febrile responses from endotoxins. According to NZ Pharmacopoeia GRP guidelines, any injectable radiopharmaceutical must be sterile and pyrogen-free. It's unrelated to radionuclide purity or radiolytic stability. Biodistribution accuracy is tested through biological validation. Pyrogenicity. Question 15. Across different scenarios, the gamma camera consistently fails to show expected line uniformity during daily QC procedures. The technologist has already performed energy peaking. What is the next best course of action? A. Replace the collimator. B. Proceed with scanning but log the fault. C. Conduct a flood field uniformity test. D. Report and service the detector electronics. Answer. Correct answer. D. Report and service the detector electronics. Explanation. Line non-uniformities persisting after energy peaking often indicate issues with detector electronics. E.g. photomultiplier tubes or processing circuits. Per vendor manuals and NZMRTB guidelines, these faults must be serviced before further use to ensure diagnostic accuracy. Flood testing confirms uniformity but won't resolve electronic failure. With scanning, breaches safety and quality standards. Question 16. Under the assumption that a technologist receives a personal dosimetry report showing exposure nearing the annual limit, what is the first step the radiation safety officer RSO should initiate? A. Suspend the technologist's duties. B. Recalibrate the personal dosimeter. C. Conduct thorough investigation of work practices. D. Inform the referring physician of potential risk. Answer. Correct answer. C. Conduct a thorough investigation of work practices. Explanation. According to Radiation Safety Act 2016 NZ and ARPANSA guidelines, if a worker's exposure approaches legal limits, an immediate investigation into their work practices and environment must be conducted. Dosimeter error is possible, but not assumed first. Suspension is excessive without evidence. Physicians do not manage staff dosimetry concerns. Question 17. The effectiveness of patient communication is a core competency of nuclear medicine technologists. Mr. Patel, a patient scheduled for a PET scan, expresses concern about radiation exposure. What is the most appropriate initial response by the technologist? A. Reassure him with technical jargon about effective dose. B. Provide a radiation dose comparison to common activities. C. Suggest he speak with his referring physician. D. Ask him to sign the consent and proceed with the scan. Answer. Correct answer. B. Provide a radiation dose comparison to common activities. Explanation. Effective communication involves explaining complex concepts in relatable terms, as emphasized in AE Competency, Framework and Code of Rights, Health and Disability Commissioner. Comparing PET dose to natural background exposure or airline travel demystifies the risk. Dismissing concerns or redirecting without addressing them undermines informed consent. Question 18. In contrast to diagnostic imaging, therapeutic nuclear medicine requires more stringent handling protocols. Why must radiopharmaceuticals used for therapy, GU-177 or 131, be dispensed in a shielded fume hood or isolator? A. To prevent mislabeling of the dose. B. To limit contamination from volatile isotopes. C. To increase yield of the isotope. D. To maintain room temperature consistency. Answer. Correct answer. B. To limit contamination from volatile isotopes. Explanation. Therapeutic isotopes like I-131 emit volatile radioactive gases. According to NZ Workplace Radiation Safety Protocols and IA standards, using shielded fume hoods or isolators protects staff and the environment from inhalation or spread of contamination. This is not related to yield, temperature, or labeling issues. Question 19. From a practical standpoint, which factor most significantly affects the spatial resolution in PET imaging? A. Patient's hydration status. B. Crystal size in the detector. C. Collimator type. D. Acquisition matrix. Answer. Correct answer. B. Crystal size in the detector. Explanation. Spatial resolution in PET is primarily determined by the size of scintillation crystals in the detector. Smaller crystals yield better resolution. Unlike SPECT, PET does not use collimators. Acquisition matrix influences resolution, but to a lesser degree in PET. Hydration affects tracer distribution, but not resolution. Question 20. In summary of best practices in pediatric nuclear medicine, what is the most critical strategy in minimizing radiation exposure for children? A. Using fixed adult dose protocols with shorter scan times. B. Administering lower energy isotopes only. C. Weight-based radiopharmaceutical dosing. D. Performing multiple scans to ensure diagnostic accuracy. Answer. Correct answer. C. Weight-based radiopharmaceutical dosing. Explanation. Pediatric protocols require dose adjustments based on weight or surface area, as mandated by IA's Radiation Protection of Children in Medical Imaging and ANSNM guidelines. Fixed doses may cause overexposure. Scan repetition increases dose. Energy selection matters, but patient-specific dosing remains the cornerstone of radiation protection in pediatric care. Question 21. Upon reviewing a set of dynamic images for a gastric emptying study, a technologist notices that the patient's stomach appears unusually large and the gastric contents remain almost stationary. What is the most probable cause for this imaging issue? A. Incorrect patient positioning during imaging. B. Failure to inject the radiopharmaceutical correctly. C. Poor synchronization between the camera and patient movement. D. Inaccurate calculation of the patient's weight for dose administration. Answer. Correct answer. A. Incorrect patient positioning during imaging. Explanation. Incorrect positioning, such as improper head or body alignment during the gastric emptying study, can distort the stomach's appearance and cause problems with the movement of radiolabeled tracers. As outlined in EE guidelines, proper positioning is crucial for accurate imaging and quantification of gastric contents, while radiopharmaceutical administration or weight-based are important. This error directly affects image quality. Question 22. Mr. Dunn, a patient undergoing a bone scan, has a history of renal insufficiency. What is the most appropriate action a nuclear medicine technologist should take regarding the radiopharmaceutical they increase the administered dose to account for renal insufficiency? B. Use a radiopharmaceutical with a longer half-life for better image quality. C. Ensure the radiopharmaceutical is appropriate for patients with renal dysfunction. D. Skip the injection step and use an alternative imaging technique. Answer. Correct answer. C. Ensure the radiopharmaceutical is appropriate for patients with renal dysfunction. Explanation: in cases of renal insufficiency, it is crucial to ensure that the radiopharmaceutical used is safe for patients with compromised renal function. Many bone scanning agents are excreted via the kidneys, and selecting an appropriate agent minimizes the risk of prolonged radiation exposure to sensitive tissues. Increasing the dose exacerbate renal risk, and skipping injection would compromise the diagnostic study. Question 23. In terms of quality control for a gamma camera, which test provides the best method to evaluate the uniformity of the camera's response to radiation? A. Intrinsic spatial resolution test. B. Uniformity flood field test. C. Energy resolution test. D. Detector calibration test. Answer. Correct answer. B. Uniformity flood field test. Explanation: the flood field uniformity test is essential for assessing the uniformity of a gamma camera's response across the field of view. Variations in uniformity can indicate issues with the camera's detectors or electronics, which could significantly impact image quality. The NZ Radiology and Nuclear Medicine Quality Assurance Guidelines require this test to be performed regularly for diagnostic results. Question 24. During a PET scan, the technologist notices that the patient's blood glucose level is elevated, potentially affecting the study's results. What is the most appropriate action to take? A. Proceed with the scan as elevated glucose has minimal effect. B. Wait until the glucose level is normalized before proceeding with the scan. C. Adjust the injection dose of FTG to compensate for high glucose levels. D. Continue with the scan but inform the referring physician of the elevated glucose. Answer. Correct answer. B. Wait until the glucose level is normalized before proceeding with the scan. Explanation: elevated blood glucose levels can significantly affect the distribution of FDG fluorodeoxyglucose, leading to false negative results, particularly in oncology studies. As per the IA and ANSNM guidelines, it is critical to ensure that the patient's glucose level is within normal limits to avoid confounding results. Adjusting the FDG is not recommended, as this does not address the underlying problem. Question 25. Mr. Thompson, a pediatric patient, is scheduled for a brain scan using technetium 99 meters. Which consideration is critical for minimizing radiation exposure during the study? A. Use a high dose to improve imaging clarity. B. Administer the dose in a single bolus injection. C. Adjust the dose based on the child's body weight. D. Perform the scan with the child sedated to minimize motion. Answer. Correct answer. C. Adjust the dose based on the child's body weight. Explanation: weight-based dosing is the most effective way to minimize radiation exposure in pediatric patients. This method ensures that the child receives an appropriate dose relative to their body size, thereby reducing unnecessary radiation. Sedation should be considered only if necessary to control motion artifacts, but does not address the radiation dose issue. Question 26. In a case of a radiopharmaceutical spill, what is the first step a nuclear medicine technologist should take to ensure safety? A. Notify the radiation safety officer and document the spill. B. Evacuate all personnel from the room immediately. C. Attempt to clean the spill using a standard cleaning agent. D. Block off the area with a physical barrier. Answer. Correct answer A. Notify the radiation safety officer and document the spill. Explanation: the immediate action after a radiopharmaceutical spill is to notify the radiation safety officer or RSO. The RO will ensure proper contamination control and decontamination procedures. Prompt reporting is essential for evaluating exposure levels and environmental risks. Simply cleaning the spill without reporting could compromise safe protocols. Evacuating the area is typically unnecessary unless there is significant contamination. Question 27. When performing a thyroid uptake study, the technologist notices that the scan does not show typical iodine uptake in the thyroid. What is the most likely reason? A. The patient did not take their thyroid medication as prescribed. B. The imaging system has not been calibrated properly. C. The radiopharmaceutical was not prepared according to the correct protocol. D. The thyroid is functioning normally with no uptake of iodine. Answer. Correct answer. C. The radiopharmaceutical was not prepared according to the correct protocol. Explanation: improper preparation or misadministration of the radiopharmaceutical, often in the form of iodine, can lead to poor uptake and inaccurate results in a thyroid uptake study. Proper radiopharmaceutical preparation is critical for ensuring the accurate reflection of thyroid function. Calibration and patient medication are secondary to radiopharmaceutical handling. Question 20. A nuclear medicine technologist is reviewing the results of a PET scan for a patient with suspected brain cancer. The images show areas of increased metabolic activity in the brain. What is the most likely reason for these findings? A. The patient has a benign brain condition unrelated to cancer. B. The increased uptake is likely due to inflammation or infection. C. The high glucose uptake is related to tumor activity. D. The PET scan is showing an error in image processing. Answer. Correct answer. C. The high glucose uptake is related to tumor activity. Explanation: increased FDG uptake is typically seen in areas of high metabolic activity, such as tumors. Malignant cells often consume more glucose than normal cells, leading to increased uptake in PET scans, while inflammation or infection can also cause elevated glucose uptake. The context of cancer suspicion makes this the most likely explanation. Question 29. During routine quality control, the technologist notices a sudden decrease in the count rate during a routine PET scan. What is the most likely cause of this issue? A. The detector crystals are not properly calibrated. B. The radiopharmaceutical is decaying faster than expected. C. The PET scanner is out of focus due to patient movement. D. There is a malfunction in the computer processing system. Answer. Correct answer. A. The detector crystals are not properly calibrated. Explanation: a sudden decrease in count rate may indicate a calibration issue with the detector crystals. This can reduce the scanner's sensitivity and affect image quality. Regular daily calibration checks are essential to ensure proper functioning. Issues with the radiopharmaceutical, patient motion, or processing systems usually manifest as different types of imaging artifacts. Question 30. In a case of a pediatric patient undergoing a nuclear medicine scan, what is the primary consideration when determining the radiopharmaceutical dose? A. The patient's age, as it dictates fixed dose for all children. B. Conservative dose based on adult protocols, reducing the risk of underdosing. C. Weight-based dosing according to the patient's body mass and health condition. D. No adjustment is needed for pediatric patients, as pediatric scans follow adult protocols. Answer. Correct answer. C. Weight-based dosing according to the patient's body mass and health condition. Explanation: for pediatric patients, weight-based dosing is crucial to minimize radiation exposure while ensuring diagnostic accuracy. The technologist should adjust the dose based on the patient's weight and health condition rather than using one-size-fits-all approach. Adult protocols do not apply directly to children due to differences in metabolism, sensitivity to radiation,